Your doctor told you everything's fine, your blood work came back normal, your heart scan looked clean, your blood pressure was fine. But you still feel it. The tightness in your chest that won't go away, the stomach that knots up before you even get out of bed, the headaches that show up every single day without a clear reason, the exhaustion that sleep doesn't fix. And here's what nobody told you. Those symptoms are real. They have a cause, and that cause isn't in your body. It's in your mind. Specifically, it's anxiety. And if you've been living with anxiety for any length of time, it has been doing things to your physical health that most people, including most doctors, never connect back to it. My name is Dr. Alex. I'm a clinical psychologist. And today I need to tell you something that took medicine decades to fully understand. Anxiety is not just a mental condition. It is a whole body condition. And when it goes untreated, it doesn't just affect your thoughts and your mood. It quietly, consistently, and very measurably damages your physical health. Your heart, your gut, your immune system, your hormones, your brain chemistry, and your ability to sleep, heal, and function. Today I'm going to show you 8 ways anxiety is destroying your health. Not metaphorically, not loosely, specifically and scientifically. What is happening inside your body right now if you have been living with untreated anxiety? And for each one, I'm going to tell you exactly what you can do about it. Last year I worked with a woman, 41 years old, let's call her Sarah. Fit, non-smoker, no family history of heart disease. She had been to her cardiologist 3 times in 2 years. Chest tightness, racing heart, shortness of breath. Every test came back clean. Her cardiologist was thorough. Her results were genuinely normal, and he told her exactly that every time. What nobody asked her, not once in 2 years of cardiology appointments, was whether she had anxiety. She had severe generalized anxiety disorder. Had it for years, had never been treated for it. And her heart, the perfectly structurally normal heart that every scan confirmed was fine, was being put through the equivalent of a daily stress test, every single day. That's what anxiety does. And Sarah's story is not unusual. It is, in my experience, remarkably common. The American Psychological Association estimates that anxiety disorders affect over 40 million adults in the United States alone. That's nearly 1 in 5 people, and the majority of them will see a doctor first not for anxiety, but for unexplained physical symptoms. Today you're going to understand why. Sign number 1, and this is the one that sends more people to the emergency room than almost any other anxiety symptom. Your heart is working harder than it should be, and it has been for a long time. You felt it. A racing heartbeat when nothing is happening. A pounding in your chest when you're just sitting still. Sometimes a feeling so intense that you're certain something is seriously wrong. Most people assume this is a cardiac problem. They go to the ER, they get an EKG, everything looks normal, and they leave more frightened than when they walked in. Because now they know the tests are clean, but the symptoms keep coming back, and that somehow feels worse. Here is what is actually happening. When anxiety activates your fight or flight response, it triggers a release of adrenaline and cortisol. These hormones tell your heart to beat faster, your blood vessels to tighten, and your blood pressure to rise. In a real emergency, a car accident, a physical threat, this response is life-saving. It gets oxygen to your muscles fast. It prepares your body to fight or run. The problem with anxiety is that this response fires when there is no emergency. Your body floods with stress hormones because of a thought, because of worry about something that hasn't happened, because of a meeting tomorrow, or a conversation you're replaying from last week. And when this happens repeatedly, every day, multiple times a day, for months and years, the cardiovascular system bears the cost. Think of it like revving a car engine at full speed while the car is parked. The engine is doing everything right. It's responding to the accelerator exactly as designed. But no engine was designed to run at maximum RPM with nowhere to go. Over time, the wear accumulates. Parts that should last decades begin breaking down sooner. A meta-analysis of research involving hundreds of thousands of participants found that people with anxiety disorders have a measurably higher risk of developing heart disease over time, independent of other risk factors like smoking, diet, or family history. The anxiety itself is the risk factor. The daily practice I want you to start today is something called box breathing. 4 counts in through your nose, 4 counts hold, 4 counts out through your mouth. 4 counts hold. Repeat 4 times. This directly activates the parasympathetic nervous system, the system that counteracts the fight or flight response, and measurably reduces heart rate and blood pressure within minutes. Navy SEALs use it before combat. Surgeons use it before operations. It works and the science is solid. Sign number 2. And this is the one that affects more of your daily life than almost any other. But almost nobody connects it to anxiety. Your gut is in a constant state of low-level crisis. Bloating, nausea, cramps that come and go, diarrhea, or constipation that has no consistent dietary explanation. A stomach that seems to have a mind of its own, reacting to things that have nothing to do with what you ate. Most people manage this for years. They try elimination diets. They take probiotics. They see gastroenterologists. And often the structural tests come back normal because the problem isn't structural, it's neurological. Here's what is actually happening. Your gut contains more than 100 million nerve cells. Researchers have given it a name, the enteric nervous system, and many of them call it the second brain. It communicates constantly and bidirectionally with your actual brain through a system called the gut-brain axis. What happens in your mind is transmitted directly to your gut. What happens in your gut sends signals directly back to your brain. When anxiety floods your system with stress hormones, those hormones directly disrupt gut function. They alter the speed of digestion. They increase inflammation in the gut lining. They change the composition of the gut microbiome, the trillions of bacteria that live in your intestines, and play a direct role in mood, immunity, and physical health. Anxiety doesn't just upset your stomach in the moment. Chronic anxiety actually changes the bacterial environment of your gut and over time. And research has shown that this microbiome disruption feeds back into the brain, worsening anxiety, lowering mood, and reducing the brain's ability to regulate stress. Think of it like a river system. The river feeds the land around it. The land filters and returns water to the river. When the river is polluted, when anxiety floods it with cortisol and stress hormones, the land suffers. And when the land suffers, the quality of water returning to the river gets worse. The cycle feeds itself in both directions. The daily practice here: slow, distraction-free eating. No phone, no screen, no podcast. At least 1 meal per day eaten slowly, with attention, in as calm an environment as you can create. This activates the parasympathetic nervous system and signals to your gut that it is safe to digest. It is a neurological intervention disguised as a simple habit. Sign number 3, and this is the one that most people have been medicating for years, often with complete sincerity and without it ever making a lasting difference. You have persistent, recurring pain, headaches, tension across the neck and shoulders, back pain that your physio can't fully resolve, jaw pain, sometimes teeth grinding, sometimes TMJ. A body that aches in ways that don't clearly connect to anything you've done physically. Most people assume this is muscular, posture, overuse, age. Sometimes it is. But when the pain is persistent, diffuse, and doesn't respond consistently to physical treatment, there is very often a different driver. Here is what's actually happening. Anxiety keeps your muscles in a state of chronic low-level contraction. Your jaw, your neck, your trapezius, your lower back, all of these muscle groups are held in a permanent state of mild tension when anxiety is running in the background of your nervous system. They never fully release. They never fully rest. Over time, this chronic tension restricts blood flow to the muscles and surrounding tissue. It generates the dull, pressing, spreading pain that most people describe as tension pain. And because it has a neurological rather than a structural cause, physical treatments provide temporary relief, but the pain returns because the driver hasn't been addressed. The same neurotransmitters that regulate mood also regulate pain signals throughout the body. When anxiety disrupts these systems, the body's pain threshold decreases. Pain that would normally be filtered out gets amplified. The volume is turned up. Think of anxiety as running low-grade background noise through every speaker in your body. Most of the time you've learned to tune it out, but over time, that constant noise wears on the system. The speakers, your muscles, your joints, your nerves, begin to show the strain. The daily practice I recommend is 5 minutes of progressive muscle relaxation before sleep. Start at your feet. Tense the muscles of your foot firmly for 5 seconds, then release completely. Move to your calf. Tense for 5 seconds. Release. Work your way up through your entire body. This practice teaches your nervous system what complete muscle relaxation actually feels like. Something many people with chronic anxiety have genuinely lost the ability to access. Sign number 4, and this is the one that is doing the most invisible damage of all of them. Your immune system is being quietly undermined. You get sick more often than other people seem to. When you do get sick, you take longer to recover. You're prone to infections. You have inflammation and may be diagnosed, maybe just a persistent sense of physical unease that doesn't have a clear label. Most people write this off as having a sensitive constitution. Bad luck. A weaker immune system that they were just born with. For some people, that may be true. But for a significant number of people with chronic anxiety, the immune dysregulation is not constitutional. It is acquired. It is the direct result of what anxiety does to the body's stress response system over time. Here is what is actually happening. Cortisol, the primary stress hormone that anxiety keeps elevated, has a complex and in many ways paradoxical relationship with the immune system. In the short term, cortisol is anti-inflammatory. In the short term, it actually suppresses immune activity to direct the body's resources toward the fight or flight response. But here's the problem. The immune system adapts. When cortisol is elevated chronically, not for hours but for months and years, the immune system's receptors for cortisol become less responsive. They down-regulate. They stop listening to the signal. And when that happens, the immune system shifts from being suppressed to being dysregulated. Inflammation that should be controlled is no longer being controlled. The system that is supposed to protect you begins misfiring. Researchers have found that people with chronic anxiety show elevated inflammatory markers in their blood work, including C-reactive protein and interleukin-6. And chronic inflammation is not a minor inconvenience. It is a driver of some of the most serious conditions in modern medicine, including cardiovascular disease, autoimmune disorders, type 2 diabetes, and certain cancers. Think of cortisol like a volume control on your immune system. In normal use, it turns the immune response down when it's become excessive and turns it back up when it's needed. Chronic anxiety jams the dial. The system loses its ability to regulate itself, and a self-regulating system that loses the ability to self-regulate becomes, over time, a source of damage rather than protection. The daily practice here is non-negotiable, and the evidence is overwhelming. 30 minutes of moderate physical movement, a purposeful walk, a light jog, cycling, swimming, anything that elevates your heart rate moderately, reduces circulating inflammatory markers, regulates cortisol output, and has been shown to directly improve immune function in people with anxiety disorders. Not next month, you can start tonight. Sign number 5, and this one gets talked about least, because it's the most invisible and the most misunderstood, even by people who know they have anxiety. Your brain chemistry is changing, measurably, in ways that affect your memory, your concentration, your ability to make decisions, and your long-term cognitive health. You've noticed it. Walking into a room and forgetting why you're there, reading the same paragraph 3 times without it landing, conversations where you were physically present but mentally completely somewhere else, a sense that your thinking is slower, foggier, less sharp than it used to be. Most people assume this is aging, or tiredness, or just a natural consequence of being busy and overloaded. Here is what is actually happening. Chronic anxiety keeps the amygdala, the brain's threat detection center, in a state of persistent activation. When the amygdala is constantly running, it draws resources away from the prefrontal cortex, the part of your brain responsible for clear thinking, planning, working memory, and rational decision-making. This is not a metaphor. Neuroimaging studies have shown that people with chronic anxiety show measurably reduced activity in the prefrontal cortex during cognitive tasks. The brain is not malfunctioning. It is doing exactly what it was designed to do. It is allocating resources to the perceived threat. It's just that the perceived threat, the anxiety, is constant. So the prefrontal cortex is constantly starved of resources. Over the long term, chronic stress and the cortisol that accompanies it have been shown to reduce the volume of the hippocampus, the brain's center for memory formation. This is not reversible without intervention. The brain you have in 10 years is being shaped by the stress your nervous system is carrying today. Think of your brain like a city with limited power. When the emergency services are called out constantly, responding to anxiety's false alarms, the rest of the city runs on reduced power. Hospitals, schools, public transport, the prefrontal cortex functions, all operate below capacity. Not because the city is broken, because all available power is being redirected to the emergency. The daily practice that has the strongest evidence base for reversing cortisol-related cognitive effects is a consistent sleep schedule. Not a consistent bedtime, a consistent wake time. Every day, including weekends. Within a 4-week period, a consistent wake time has been shown to restore cortisol rhythm, improve working memory, reduce anxiety symptoms, and measurably increase prefrontal cortex activity during cognitive tasks. One habit, measurable results, start tomorrow morning. Sign number 6, and this is the one that quietly steals years of quality life without anyone naming it for what it is. You are exhausted in a way that sleep doesn't fix. Not tired, exhausted. The kind of bone-deep fatigue where you wake up already depleted, where afternoons are something you survive rather than live, where caffeine stops being a preference and becomes a functional requirement just to keep pace with the demands of a normal day. Most people blame their sleep quantity. They try to sleep more. It doesn't work, and because the problem isn't the quantity of sleep, it's the quality. And the quality is being systematically undermined by something that happens before you ever close your eyes. Here is what is actually happening. Cortisol has a natural daily rhythm, a curve that should rise sharply in the morning to wake you up and promote alertness, and fall gradually throughout the day, reaching its lowest point in the evening to allow sleep to come. Chronic anxiety disrupts this rhythm. Cortisol stays elevated throughout the day and often well into the evening. When you lie down, your nervous system, which is supposed to be in wind-down mode, is still partially activated. The sleep you get is lighter, less restorative, interrupted more often, and spends less time in the deep stages where physical repair and memory consolidation happen. And because the sleep is less restorative, the body doesn't fully recover from the demands of the day. The next day starts with a deficit, and the cortisol dysregulation that caused the problem is worsened by the insufficient recovery. The cycle deepens. Think of your sleep like a cleaning cycle for your brain. During deep sleep, the brain's glymphatic system, a kind of waste removal system, flushes out metabolic byproducts that have accumulated during waking hours. Anxiety disrupts the cleaning cycle. The waste accumulates. The brain operates on a system that isn't being properly maintained. The daily practice I recommend for this is a consistent, non-negotiable, wind-down routine beginning 90 minutes before sleep. No screens for the last 60 minutes. Dim the lights in your home. Lower the room temperature slightly if you can. Write down every task and worry on your mind onto paper. Not to solve them, but to externalize them, which measurably reduces nighttime rumination. Do your progressive muscle relaxation. Let your nervous system receive the signal that the day is done. See, sign number 7. And I want to talk about this one carefully because it's the one that most affects the people around you, even more than it affects you directly. Your relationships are suffering in ways you may not fully see. Short fuse, impatience, a sense of emotional distance even with people you love, moments where you snapped at someone and didn't fully understand why, a general feeling that intimacy, real, present, connected intimacy, has become harder to access. Most people assume this is a relationship problem, or a communication problem, or a personality problem. They work on their relationships. They improve their communication. And things get better temporarily, then drift back. Here is what is actually happening. Chronic anxiety depletes what researchers call the emotional bandwidth of the prefrontal cortex, the capacity to be patient, empathetic, flexible, and emotionally available is a cognitive resource. And it is a resource that anxiety consumes. When anxiety is running in the background, the tolerance threshold for frustration is significantly lower. Small inconveniences break through where they would normally be managed. The emotional dam, as I described in a previous video, is already cracked before the day has even properly started. At the same time, anxiety creates a pull toward withdrawal and self-protection. The very people whose presence could reduce anxiety become sources of perceived demand. Connection, which the healthy brain experiences as rewarding, begins to register as effortful, and so people with chronic anxiety often find themselves emotionally absent, even when they are physically present. The practice for this one is counterintuitive. Do not try to improve the relationship directly. Reduce the anxiety. As the anxiety reduces, the emotional availability returns, often quickly and noticeably. In the meantime, communicate what is happening. Tell the people who matter to you not what you are feeling, but why. I've been struggling with anxiety and it's affecting my patients lands very differently than a repeated pattern of snapping followed by silence. Sign number 8. And this is the one I'm going to leave you with because it's the most important of all. You have normalized it. Not consciously, not as a choice, but somewhere along the way, 6 months ago, 2 years ago, maybe much longer. What you're experiencing stopped feeling like a problem and started feeling like just the way things are. The tight chest, the racing thoughts, the sleep that never fully restores, the stomach that never fully settles, the exhaustion, the distance, the pain that comes and goes without explanation. At some point, you stopped noticing them as symptoms and started experiencing them as personality, as your constitution, as who you are. And this normalization is the most dangerous thing anxiety does. Not because it kills quickly, but because it kills slowly and silently. And it convinces you while it's doing it that this is simply the texture of your life. It isn't. Every single thing I have described today, the cardiovascular strain, the gut disruption, the immune dysregulation, the cognitive fog, the sleep destruction, the physical pain, the relationship erosion. Every single one of these is a consequence of something treatable. Anxiety disorders are among the most treatable conditions in all of mental health. Cognitive behavioral therapy has decades of evidence behind it. Medication helps many people significantly. Lifestyle interventions, and the ones I've described today, have genuine, measurable, research-backed effects. You do not have to keep carrying this, but you do have to make a decision. And the decision is this: to stop treating the symptoms and start treating the cause. I want you to do something right now, before you close this video. Before you move to the next thing on your list, I want you to sit for 30 seconds and ask yourself honestly, how long have I been feeling this way? Not the symptoms in isolation, but all of it. The full weight of what I've just described. How long has this been the background noise of your life? If the answer is months or years, please talk to someone. A doctor, a therapist, a mental health professional. Today, not next week. You came to this channel because something in you recognized what I was describing. That recognition matters. Don't let it pass without acting on it. If this video helped you, share it right now. Send it to one person. You might be giving them the words for something they have felt for years but never been able to name. Type in the comments. How many of these 8 signs are you carrying right now? 1 through 8. I read every single one. Subscribe for a new video every week. In the next video, I'm going to walk you through exactly what happens inside your brain during a panic attack, second by second, and the single 60-second technique that stops it faster than anything else I have ever seen work in clinical practice. I'll see you there. I'm Dr. Alex. Your anxiety is not your personality. It is a condition, and conditions can be treated.